On December 12th of 2019, according to the CDC, a group of people in the city of Wuhan, China, began to experience the symptoms of an atypical pneumonia-like illness, and it did not respond well to standard treatment. By January 20th of 2020, the CDC reports the first lab-confirmed case in Washington state. By March 11th of 2020, the World Health Organization declared the COVID-19 outbreak a pandemic. News 19's Dave Soley spoke with Bellin and Gunderson Health System CEO Scott Rathgaber about the process of dealing with the pandemic when it started. So Dave, they started with the uncertainty created by it.
Yeah, Heather, that's right. In March 2020, Dr. Rathgaber says they realized they'd soon have to deal with this problem. In the third week of March, he says Gunderson had its first case. At the same time, the medical community was still working to understand the virus. And as cases began increasing throughout the country, Rathgaber says the hospital had to consider how many supplies they had, how a surge would affect that supply, and how many days they could treat patients under those conditions. The answer, they determined, was relatively few.
And the time that I remember very vividly where it really hit home was when we started to talk about, well, what would we do if we didn't have enough supplies, enough ventilators and those things to care for all the patients. And so we started to put together protocols and rules on how we would decide who would go and get the supplies and who wouldn't. And that was extremely sobering. Thank God we never had to do that, but it was the kind of thinking that we had to go through as the pandemic started to grow. And that was when you knew we were in for trouble.
Now, despite dealing with those issues daily, Rathgaber says he remains impressed by a medical staff who would put their lives on the line for people who needed care. Inspiring, he says, but it didn't mean that it was not difficult for those people to live through, Heather.
All right, not at all. Thanks, Dave. Coming up tonight at 6, what Dr. Rathgaber says was the hardest part of the pandemic and what caused a turning point in the severity of the virus.